Well, today we're talking about pain issues that both Andrea and Mr. Birdsey have experienced. So, Bill, good morning, and I understand that you were experiencing intense jaw pain when you first visited Dr. Smith. Could you please tell us about it?
Yes, probably a little background prior to that. I quit smoking out of seminary and chewed gum for almost 60 years. I also grit my teeth, and therefore I ended up with 32 caps on my teeth and a relocation of my bite. And then after a period of time with no gum and with the caps, I found that one day I woke up and it felt like I had an abscessed tooth. And I went to my doctor, and we x-rayed, and she beat around and she poked around and she blew air and couldn't find anything, and said, we may have to send you to a specialist and see if they can do a root canal on you. And I went along a little bit further, and then I just began to get into great pain, and I am one that basically has no pain problems. And I got to a point that I just couldn't stand it. I was taking Advil and codeine in order to survive, and I went to my wife's pain doctor and asked a question if he could give me a shot in my jaw to get to where that I could quit hurting. And he said, I don't do jaws, but I know a man that knows how to work on them, and referred me to Dr. Smith. I came up to Dr. Smith, and when we did the initial workup, we found that not only did I have some jaw pain, but I also was having headaches, I was having earaches, I was having some neck pain in my right side, and my left side was giving me some pain as well. And so I put all my trust in the world in him, because I was hurting enough I didn't want to continue where I was. And this is how we had our beginning, was that I just was in so much pain that I couldn't go without finding some relief.
And what was the treatment that Dr. Smith prescribed for you?
He put stuff in my ears and put stuff in my mouth and messed around, and he found that he needed to move my jaw outward and move it over. Over the years, the back of the joint had worn, and the jaw had moved back into the back of the back, and I was getting pain in my right side because my left side was in the wrong location and not doing well. So he prescribed putting apparatuses in my mouth, and I've said in the past, when I looked at the apparatuses, I thought, how long are we going to have to wear that stinking junk? Now I maybe have 2 minutes a day that I don't have them in my mouth, because the pain is gone and I just feel very good. And so all of that mouth stuff is just a bunch of stuff, and you learn to talk with it, not worry about it, and you learn to eat with it, not worry about it.
Do you have it in your mouth right now?
Got it in my mouth right now, yes.
Wow, and I would have never known that.
The one I have in my mouth right now is the everyday wear one that keeps your teeth where they're supposed to be. The nighttime apparatus that the doctor put on me looks like a horse's I don't know what, that hooks the upper jaw and upper teeth and lower teeth together and don't let you move your mouth much. And when I came back the first time, I had to get him to cut a hole in the mouth of it so I could develop a whistle so that I could breathe in and out without having to crank my mouth open. And so that has really been a help. And then he also has an apparatus. This apparatus I have in right now, you can't eat with. But he made one that you can eat with. The only problem with eating with the apparatus is it makes you a chipmunk. You know what a chipmunk is? Their jaws get full. When you chew, the food is pushed down around. You know what I'm talking about, don't you? No? You don't chew, you don't eat with yours, huh? Okay. But when you chew, it gets down under, and so you're cleaning your mouth out. But boy, it's sure nice, and I don't care what anybody thinks. It's comfortable, and I feel good.
Well, that's wonderful. Wonderful. I think that not necessarily a miracle, but it sure must feel sort of like a miracle to have life without pain.
Yeah, it is more than a miracle in terms of finding someone that, one, knows something, two, knows what to do with it, and then three, finding out that, yeah, it did come out and you're not hurting.
Wow, that's wonderful.
Yeah.
Mrs. Lee, good morning. Please share with us the medical issues which brought you to Dr. Smith and what happened.
Well, the medical issue that brought me to Dr. Smith in the first place was a lot of jaw pain, and I felt like I was grinding my teeth. I went to my regular dentist and thought I could get help there, and he referred me to Dr. Smith. Initially, I had a lot of pain in my jaw, and then when I spoke with Dr. Smith, he let me know that other things can happen as well. You can have ear pain, neck pain, headaches, all of which I did have. I had trouble chewing, and when I woke up in the morning too, I would feel like I had to realign my jaw. And apparently, according to my husband, I snored. I don't think so, but I did. So when I went to Dr. Smith, and he explained what I could be feeling because of this misalignment in my jaw, at first I thought, no, I don't think so. I had braces on twice when I was younger, the last time when I was 21 years old. And I thought, no, they took care of my teeth. I have beautiful teeth now. And of course, Dr. Smith agreed that I did have beautiful teeth, but they were still out of alignment. So after the x-rays and some explanation, I agreed that that's probably what would happen. And also because of the sleep apnea study that he did, we figured out that that wasn't the problem, that it was all in my jaw alignment. So Dr. Smith helped me by doing the casting of my teeth, showing me how the alignment was off, and showing me that I could wear an appliance during the day, which I have on right now, and then also at night to put the appliance in. And you do look a little funny, but your husband still loves you, so it's okay. Now, I have found that because of that, I no longer have the jaw pain. Also, the anxiety that came with it, the anxiety that I was getting headaches and I was getting this jaw pain and it was hurting when I was eating, that wasn't any fun. So now I can relax knowing that this is taking care of it. I've had the appliance on for about 6 months, so I'm still pretty new to it. And I still feel like maybe I talk a little funny, but it doesn't matter. I feel good.
That's wonderful, Mrs. Lee. Again, you feel good, and that's what it's all about.
I do. I feel much better.
Thank you for watching this video. Please visit our website, sleepbetterdoc.com. We look forward to seeing you. Please call for an appointment to schedule. Thank you.